Hello, my viewers all over the world. You're welcome to our channel. My name is Chris, your regular health professional and educator. So I want to warmly welcome you to today's edition. And today's edition is going to be the continuation of our last video where I discussed PID, and I'm going to continue. It's just like a series, and if you did not watch the last one, you just need to watch, because you may not really understand this one. So you have to watch that in order to have proper knowledge of what I want to discuss now. So I want to discuss the risk factors of PID, the things that when you do them, it will expose you to this infection. All right, so you have to pay very rapt attention, listen to all that I have in stock for you. I hope you are ready for today. All right. The first one I would want to say is this: being sexually active early. As a young lady, when you start having sex too early, you will expose yourself to this infection. Okay, and then the second one, second risk factor is when you have multiple sexual partners. Right? You may not be the one. Maybe if it is your partner that has the multiple sexual partners, the person can bring this bacteria and come and infect you with them. You are exposing yourself to this PID, this infection. So when you have multiple sex partners, it can expose you. You are increasing the risk of this PID. All right, and then when you do not protect yourself, for instance, you are meeting someone for the first time and you want to have sex with the person, you don't know the medical history of that person, and you are not using condom, it means that you are exposing yourself. Okay, you are increasing the risk of you contacting this infection. So you see. Now, another one I want to mention, another risk factor, is when, as a lady, you always douche. What do I mean? You always wash your private part. Especially there are people who wash with solution. They wash with hot water. I know you want to keep that place clean. Yes, of course. Cleanliness is very good. But it has to be moderated. When you wash it all the time regularly, you may end up causing more harm than good. So you have to take note of that. And when you have history of PID, you've had PID before, or you have sexually transmitted infection, STI, it can increase your chance or increase the risk of this PID. I hope you are following what I'm saying. Now let me tell us the complications, the problems where you face. Okay, there are a lot of complications. I'll just share with you few of them, and they are the ones that they are the key ones. I will just tell you. Now the first one I want to tell you is this. In my last video, I told you about scar tissue. It can leave a permanent scar on your reproductive organs. It could be on your uterus, it could be, in your fallopian tube or in your ovaries. So there could be scar tissue. And you see, this scar tissue is irreversible. They come back. Once the damage is done, it is done. Okay? So the complications, I will just list them. I've said something about scar tissue. Now, ectopic pregnancy. Yes, it can result to ectopic pregnancy. I will explain. You know that fertilization occurs in the fallopian tube. And after the egg has been released, the sperm, they swim to the fallopian tubes, and then once they see any egg there, they fertilize. So after fertilization, the next thing that should occur is implantation, and it does not supposed not to occur in the fallopian tube. So the egg, the fertilized egg, will make its way down to the uterus, your womb. Alright? So when there is scar tissue, it can prevent this fertilized egg from reaching your uterus. And because of that, it will just implant in your fallopian tube. And once that happens, the medical condition, the medical name we give to it is ectopic pregnancy, because it is not in the right place. Pregnancy is supposed not to develop in the fallopian tube. Alright? And once that happens, in fact, it's a very life-threatening issue, because you'll be bleeding massively and it will require emergency medical attention. So you see that complication. Now, another one complication I want to tell you is infertility. The longer this infection stays in your reproductive tract, the more harm it creates, it causes, the more harms more harmful it becomes to your reproductive tract or organs. So it can damage your reproductive organs, it can damage your uterus, it can damage your fallopian tubes, it can damage your ovaries. And once any of them is damaged, it can prevent pregnancy. Alright? So it can lead to infertility as a result of the damage done to any of these reproductive organs. Now, another complication is chronic pelvic pain, probably as a result of the scar tissue. It may be during sexual intercourse with your partner, you'll be experiencing very serious pain. Okay, so that's another one. It will be very uncomfortable, very, very discomforting rather. To be very discomforting. So you have to take note of that as another complication. And then I've said something about abscess water, right? There could be tubo-ovarian abscess. It could develop in your fallopian tube, it could be in your uterus, it can also be in your ovaries. So it can form abscess, it can lead to abscess. And once that, it is left untreated, it can bring life-threatening infection. It can bring a permanent damage to these reproductive organs. Alright, so I believe you are listening. I've said something about the risk factors. I've talked about the complications. So let me talk about the prevention just in a jiffy. I'll just talk about the prevention. Now, you see, when I talked about the risk factors, I said something about having multiple sexual partners. So you have to protect, yourself. You have to practice safe sex. When you are seeing somebody for the first time, you don't know the medical history of the person, you have to protect yourself if you must have sex or sexual intercourse with the person. And for those of you who are having IUD, intrauterine device, it can only prevent pregnancy. It cannot prevent infection. Okay, so you have to visit your health provider so that he will advise you on how to go about it. So don't feel that because you have that is a bulletproof. No, it can only work, in preventing pregnancy. And you have to get tested. And once you are diagnosed with it, you have to treat yourself and make sure that your partner is also treated. Because if you get treated and your partner, does not get treated or is not treated, the infection can reoccur. So that's why you have to get yourself treated and also your partner. And you have to stop doubting. Wash your private part, yes, but let there be moderation. Let there be moderation. And hygiene is very important. Yes, it's very important. Because you see some women, they will wear one pant for 2 days, 3 days. You just have to pity your body. Please maintain a very good hygiene. Some people will wear wrapper very dirty, wear some undies very dirty. You are endangering your health as a woman. So we have to take note of hygiene. It's very, very important. Okay, so now let me end this by telling you the treatments. Okay, I have to tell you what you need to do. The treatment for this is antibiotics. I told you the cause, that it can be caused by bacteria. So now when you have any of these symptoms like that I discussed in my first video, you have to visit your hospital. Your doctors have been trained to take care of these kind of situations. So you have to visit, and they are going to place you on antibiotic therapy, and it will reverse this condition. But let me say this: you have to visit your hospital very early, not when damages have been done and then you now want the antibiotics to reverse the whole thing. Once scar or scarring, of any tissue is done, antibiotics cannot reverse scarring. So you see, it's very important that you visit your health provider very early. Okay? And remember that self-medication is not the best. In this video, I've discussed the risk factors, the complications, the prevention, and then the treatment. And please, I would like you to like this and comment. I would really like you to comment, because your comments will be very well appreciated. And please share this, because other people out there would want to learn these things that you have learned now. Please don't deprive them of this knowledge. Okay? Yeah, and I hope to see you in my next video, because we are ready for you. Thank you for watching.